Very good evening, everyone. It gives me immense pleasure to welcome you all. I would say this episode is going to be very, very special because it is just after our new committee, new body. I would say new people with more zeal, and we're going to see many, many more new things which are going to come in Diabetes Bytes and in other episodes as well. So let me at the outset first welcome our newly elected president, Dr. Bridgewater, sir. A very good evening, sir, and thank you
Thank
so
you.
much for
Good
joining us
evening,
today.
everyone.
Good evening, sir.
Let me welcome our newly elected Vice President, Dr. Murthy. He's a senior consultant physician, diabetologist, very good friend of mine from Bangalore. Very good evening.
Good evening, Faraz. Thank you.
Let me take the opportunity to welcome our two other panelists, Dr. Bharat Saboo, again a senior consultant physician and diabetologist from Indore, a very vibrant city, I would say. Very good evening.
Thank you, Dr. Faraz. Thank you.
And I would take the opportunity to welcome my colleague from Hyderabad, Dr. Yousuf Khan, a physician and diabetologist. Very good evening, Yousuf.
Yeah, very good evening. Good evening to everyone.
Good
So
evening.
today I'm gonna. I think our whole talk is revolving around pre-diabetes. We've talked so much about diabetes, but still, if you ask me, pre-diabetes is just what we are seeing is just, I would say, diabetes is the tip of the iceberg. There are a huge number of cases. So today we will try to understand why it is important to diagnose the patient early and how does it help your patients in his journey. So to take it ahead, I would request Dr. Bridgewater sir to give his version and then Dr. Alice Murthy to take it from there. Sir, over to you.
Thank you, Fraz. At the outset, I would like to, once again welcome our viewers who are watching this program for now more than 1 year, and they are the key to success of this program. We all are now, pretty sure that Diabetes Bytes is a very important public education initiative of RSSDI, where we have been discussing the various aspects of diabetes, not only diabetes, all related disorders also. And time to time, we have been using, different modalities of communication, focusing on different theme areas where RSSDI is working. Now, pre-diabetes is again one of the very important areas which needs to be addressed if you're looking at diabetes. We all know diabetes is, phenomenally prevalent in India. We have more than 77 million diabetes people. And if we look at the number of people with pre-diabetes, which, in layman language is a stage before the development of full-fledged diabetes, the number is even higher. And there are some certain peculiar aspects of diabetes which I would briefly highlight. One is that once you get pre-diabetes, there is not only increased risk of developing full-fledged diabetes, there is already increased risk of developing high blood pressure, cholesterol abnormalities, heart disease, and increased risk of early mortality. And there are other related, disorders or disease processes which have already begun in the body, which are related to the insulin resistance. Now, second important thing that we have to keep in mind is that since this is technically or labeled as pre-disease, like when we say pre-diabetes, it's pre before diabetes. So there is hardly any sign or symptom which leads to recognition of this entity in clinical practice. So we have to be suspicious. We have to be, looking for it rather than patient will show up with pre-diabetes in clinic. We have to suspect pre-diabetes to diagnose it. And it is very important to diagnose it early because if we do that, not only we can put in measures which prevent the onset of diabetes or delay, at least delay the onset of diabetes, but are also helpful in reducing the risk related to development of heart disease or heart related mortality. So I think it is very important aspect of diabetes which needs to be kept in mind. and needs to be addressed in clinical practice also.
Sir, thank you very much for that beginning. I think you summed up all our discussions, which we had planned over 30 minutes. I think 5 minutes you rounded up, so we can
So
as well
I gave
end.
you I gave you enough points to discuss.
Exactly, sir.
Yeah,
And
thank you so
sincere
much,
thanks,
sir.
sir, for even though you had a prior commitment, because this is our first official program after the new vibrant executive committee has taken over under the leadership of Makar sir. Though we had good tenures with Bansi sir and Vasant Kumar sir earlier two terms. Now we know Makar sir is very meticulous, is very SOP driven, very strict person when it comes to execution of plans, and that is what we are very eager and of course little apprehensive also, because he's a very strict person in the back end. And I'm sure RSSDI will reach to new heights with new programs wherein we reach out and educate. That's our primary core,
So
to educate and make people aware. Sir,
so
you're about.
Srinivas, I'm sure you were praising me.
Two sides of the coin, sir. I'm requesting
anyways,
indirectly.
anyways,
Don't be very.
have a good program. I will have to excuse myself because I have other
Please, sir.
commitments.
Please,
So
yeah,
next
yeah.
Thank you
week
so
I'll be
much,
definitely
sir.
joining for a
Thank
longer
you for
time.
taking our time.
Thank you, sir. Thank you,
Thank
sir.
you.
Thank you,
So
sir.
today is a Karwa Chauth and also Sankashta Chaturthi, very auspicious day to begin our official program. And we sincerely
Sreenivas,
thank
if you
Makar sir.
can just give me, Sreenivas,
Yeah,
sorry for
Faraz.
interruption. If you can
Yeah,
just
yeah.
give me 1 minute, I want to introduce our one more panelist, Dr. Nanditha Arun, physician and consultant diabetologist from Chennai. A very good evening to you, ma'am.
Thank you, doctor. Good
So
Yeah,
evening.
Faraz, you
yeah,
showed the
yeah.
gender inequality. You introduce all the males first and the ladies last. So that means they are reached up to the mark. So they
He
are
saved the best for the
Oh,
last.
I, you
very
you
nice.
already said
That's a
you
good
already
one.
said we are
And
having a special
today's,
day, so it's now
yeah,
time to
Saving
you.
grace.
true. And
Please
today's
please take
specialty
it
is
from
we
here.
can speak 5 languages and we will interact in 5 languages. That's English, Hindi, Tamil, Telugu, and Kannada. And that's the best part of it. And I don't think we can have any other program which involves 5 languages. And let's start with the pre-diabetes, the burden of pre-diabetes. Bharat, I'll begin with you. आप क्या समझते हैं प्री डायबिटीज क्यों हमें ये इम्पोर्टेंस देना है, और ये परसेंटेज या इंसिडेंस हमारे देश में कितना है ये बर्डन कंपेयर टू डायबिटीज?
सर मूर्ति सर, थैंक यू। ये बहुत अच्छा सवाल है एक्चुअली, और सारे ऑडियंस जो इसको सुन रहे हैं उनको मैं ये बताना चाहता हूँ कि प्री डायबिटीज को भी हमको उतना ही सीरियसली लेना है जितना कोविड के बाद हम डायबिटीज को लेने लगे। क्योंकि प्री डायबिटीज जैसा कि नाम से स्पष्ट है, डायबिटीज के पहले वाली अवस्था। इसके बाद आप जो नेक्स्ट स्टेप में जाएंगे वो डायबिटीज होगी, क्योंकि ये वो अवस्था होती है जब बॉडी का, हमारे शरीर का जो इंसुलिन है उसके खिलाफ रेजिस्टेंस बढ़ जाता है, तो वो वैसा काम नहीं कर पाता जैसा उसको करना चाहिए। एंड रिजल्ट इज डायबिटीज। एक रीसेंट सर्वे जो अभी अभी हुआ था उसमें द प्रिवेलेंस वाज 14%, 14% लोगों को प्री डायबिटीज था। 100 में से 14 लोग प्री डायबिटीज से पीड़ित हैं। बट कहीं ना कहीं हमारा दुर्भाग्य है कि बहुत सारे लोगों को इस बारे में पता ही नहीं है कि उन्हें प्री डायबिटीज है। तो बहुत जरूरी है कि हम इसके लिए एक अवेयरनेस जैसा कि हम लोग कर रहे हैं, और ये RSSDI इसके लिए धन्यवाद की पात्र है कि इस प्री डायबिटीज के इशू को इतना अच्छी तरह से उठाया है। तो सारे लोगों को अवेयर करने की बहुत जरूरत है कि प्री डायबिटीज को डायबिटीज जितना ही खतरनाक माने, पर साथ में एक और कारण है जिसके लिए प्री डायबिटीज की तरफ हमारा ध्यान होना चाहिए, क्योंकि प्री डायबिटीज वो अवस्था है जहां हम उसको रिवर्स या रिमिट कर सकते हैं। डायबिटीज होने के बाद रेमिशन संभव है, रिवर्सल बहुत मुश्किल हो जाता है, नहीं के बराबर संभावना है उसकी। बट प्री डायबिटीज वो अवस्था है जहां हम खान पान की आदतें, बाकी चीजें हमारी सुधारें, लाइफस्टाइल मेजर्स अपनाएं, तो हम डायबिटीज से बच सकते हैं।
Wonderful. Thank you. Dhanyavad, Bharat. Nandita, the next question goes to you. Why do you think people develop pre-diabetes? எதுக்காக என்ன ரிஸ்க் ஃபேக்டர்ஸ் தேடணும், எப்படி கண்டுபிடிக்கிறது? ஏன்னா இதுக்கு சிம்டம்ஸ் கிடையாது. மோஸ்ட் ஆஃப் தெம் இஸ் ஆக்சிடென்ட்லி டிடெக்டட். ஹெல்த் செக்ஸ்ல வந்து நம்ம கண்டுபிடிப்போம். பட் எப்போ ஒரு ஆளு டயபிட்டிஸ் இல்ல ப்ரீ டயபிட்டிஸ் இருக்குன்னு ஒரு சந்தேகம் வரலாம், அதுக்கு உங்களோட அபிப்பிராயம் என்ன நினைக்கிறீங்க?
Right. So, pre-diabetes, as the name indicates, na Tamilum, English, rendathayum mix panni pesa poren. So, pre-diabetes, as the name indicates, it is a precursor, just like Dr. Bharat was addressing, to the disease itself, which is diabetes. And this is very important, as the title for our program today reads. It is a ticking time bomb, because these are patients or people, they're not even patients as yet. They're people who are waiting to convert to the disease, which is diabetes itself. And so this gives us a window of opportunity to take action even before the disease sets in. And that is the importance of today's program. So it is extremely important for us to be equipped to identify those at higher risk. அதாவது யாருக்கெல்லாம் இந்த pre-diabetic stage, அதாவது diabetes இல்ல pre-diabetic stage வரலான்றது நம்ம முன்கூட்டியே ஐடென்டிஃபை பண்றது ரொம்ப ரொம்ப முக்கியம். So அப்படி பாத்தீங்கன்னா, the risk factors are actually common between both diabetes and pre-diabetes. And they can be divided into two groups, the non-modifiable and the modifiable risk factors. And to sort of summarize that, I'm not going to go into the details of non-modifiable and modifiable, but to look at it more from the sort of more pragmatic point of view, it is important to do what is called opportunistic screening. That is, we as doctors, and we should even train our paramedical staff and nurses and whoever comes in contact with patients as far as possible, to do what is called as opportunistic screening. Why is this important? Is because just to go out there into the field and screening everybody would be cumbersome. It would be a waste of resources. And in a country like ours, it is not feasible, where we are a huge population. So opportunistic screening would involve those who come in contact into the medical system for any reason unrelated. That is, they do not present for screening, but those who present for any other illness, for example, with a fever or a cough or a cold, or those who come in contact with into the medical system, should be screened for diabetes. And should we screen everybody? The answer to that is no. So we have what is called the diabetes risk score, which is a non-invasive score. And in the risk factors, there are a number of it's a simple tool which will help us identify those at higher risk of pre-diabetes or diabetes. So idhila risk factors in pathona, first factor vandu vayadu, adhaadu age above the age of 35, and the age is a little younger for our Indian population as compared to the Caucasians, because we have a younger age of onset to start off with. Number 2 would be a strong family history. அதாவது பரம்பரையா யாருக்கெல்லாம் ஃபேமிலியில அவங்க அப்பா அம்மாக்கு இல்ல கூட பிறந்தவங்களுக்கு டயபெட்டிஸ் இருக்கோ அவங்களுக்கு வரதுக்கு உள்ள வாய்ப்பு வந்து இன்னும் ஜாஸ்தி. மூணாவது பாத்தீங்கன்னா, those who are obese, and the factor for the measurement of obesity, best measure would be abdominal obesity. அதாவது வயிறு waist circumference, வயிறு சுற்றி இருக்கிற அளவு. So waist circumference or waist tip ratio, which is a simple tool, just measure the waist and that will give you an indicator. Then last, many other factors would be sedentary lifestyle, and those with high, risk factors, like other risk factors like smoking and so on. But these are the major risk factors which would indicate that the person may be at high risk of diabetes or so-called pre-diabetes. And once we identify these risk factors, we can easily identify those who are at higher risk. We can easily screen and intervene early to prevent the disease from progressing.
Great. I think great points. Important points is that you need to identify early and do that opportunistic screening whenever they come to us. Like the patients bring their father, mother to us, and we can screen them, the son, daughter who comes to us. That's the simplest tool which we can do. A random sugar itself is enough many a times when the walk-in comes. Now, let's move on to how do we diagnose? We are talking about the burden of pre-diabetes. We spoke about the risk factors involved in diabetes. And now let's look at how do we diagnose. And to answer this, we have Dr. Yousuf Khan. And Yousuf, mana ee sugar ni kanukunedi elaga? Ippudu manaki suspicion untadi, but valliki pakkaga manam cheppagalama intunte ee range lo unte meeru pre diabetic, ee range loki velte meeru diabetes convert ga avtaru anedi manaki ela telustadi?
Right. So first of all, I'm really happy to see all our prevention task force members together. Sreenivasa sir, Dr. Bharat, Dr. Nanditha. I was waiting for this moment actually. And I would like to congratulate the Diabetes Bytes, the longest diabetes series, I think, in the history of this diabetes management. And I would like to congratulate Dr. Purvi and Dr. Faraz and Dr. Makkar sir for the wonderful Golden Jubilee conference we had at Chennai. And my best wishes to the new executive committee. And you are an esteemed member of the committee, sir. So moving forward, Dr. Bharat already mentioned the prevalence part is very high as far as pre-diabetes is concerned. Dr. Nanditha, she has explained which patients we need to screen. And the next question the patients ask is, see, I have this report with me. This is my fasting plasma glucose report. now whether I am diabetic, pre-diabetic or normal. That is usually the patients ask. So for diagnosing, we better use all the three parameters. That is before breakfast, that is fasting plasma glucose, after the breakfast, that is postprandial glucose, and also the HbA1c. So if the fasting plasma glucose lies in between 100 to 125, that is pre-diabetes. And if it crosses 126 or above, then it is over to diabetes, and that will require treatment from the beginning. As far as postprandial glucose is concerned, if it is between 140 to 199, it is pre-diabetes. And if it crosses 200 and above, it will be in the diabetic range. Similarly, the HbA1c, it should be in between 5.7 to 6.4 to be called pre-diabetes. And if once crosses 6.5 and above, it is overtly diabetic, and then we will require treatment. So these three parameters, I think, we can take into account. And as far as the fasting plasma glucose is concerned, దీంట్లో కొంచెం డిఫరెన్స్ ఉంది. అంటే ఏడిఏ వాళ్ళు కొంచెం తక్కువ కట్ ఆఫ్ పెట్టారు. ఫాస్టింగ్ ప్లాస్మా గ్లూకోజ్ నార్మల్ ఇండివిజువల్స్ కి 100 అని పెట్టారు, అంటే టోటలీ హెల్దీ ఇండివిజువల్స్. అండ్ డబ్ల్యూహెచ్ఓ వాళ్ళేమో 110 mg per deciliter పెట్టారు. సో దీన్ని బట్టి ఏడిఏ స్టాండర్డ్ తీసుకుంటే ప్రివలెన్స్ ఆఫ్ ప్రీ డయాబెటీస్ చాలా ఎక్కువ అయిపోతుంది, ఆల్మోస్ట్ 35% వరకు వెళ్తుంది. అదే డబ్ల్యూహెచ్ఓ 110 పట్టుకుంటే సార్ 19%, అది కొంచెం తక్కువ ఉంటుంది. వెదర్ ఇట్ ఈస్ 19% or 35%, both are very high. So definitely eye of suspicion అనేది ఉండాలి. ఎనీ పేషెంట్ అండ్ అటెండర్ కమింగ్ టు ద క్లినిక్, వాళ్ళకి క్వశ్చనర్ ఇవ్వడము, లేకపోతే డయాబెటీస్ రిస్క్ స్కోర్ ఇవ్వడం, ఇది చేయడం, తర్వాత ఆ రిపోర్ట్స్ ని బట్టి వాళ్ళకి ఎక్స్ప్లెయిన్ చేయడం ద్వారా ఐ థింక్ అవేర్నెస్ ని పెంచవచ్చు సార్, అండ్ వీ కెన్ డయాగ్నోస్ ఇన్ ప్రాపర్ టైం.
కరెక్ట్. అండ్ చాలా మంది రిలేటెడ్ టు దిస్ క్వశ్చన్ యూసుఫ్, చాలా మంది వచ్చి సార్ రాత్రి నేను స్వీట్ తిన్నాను, అందుకే ఇది ఒక 2 milligrams ఎక్కువగా ఉంది, సో నేను వేరే ల్యాబ్ లో చేసుకుని వస్తాను అని చెప్తారు. వాట్ ఈస్ యువర్ కమెంట్స్ ఆన్ దిస్, విచ్ మోస్ట్ ఆఫ్ ద పేషెంట్స్ సే ద ప్రీవియస్ నైట్ ఐ హాడ్ సమ్ స్వీట్ డిష్, సో ఇట్స్ గాన్ 2 milligrams above that range, so the next day I checked in the other lab, it is absolutely normal. సో ఇలాంటివి మీరు ఫేస్ చేసినప్పుడు ఎలా, what is your advice?
We should not rush for the diagnosis. That's what I feel. Because diagnosing and condition అనేది చాలా స్ట్రెస్ఫుల్ ఉంటుంది పేషెంట్ కూడా. Sometimes patients they are taken back. అది ఫ్రస్ట్రేషన్ కావచ్చు, sometimes they are angry, sometimes denial లో ఉంటారు. So I think at least 2 readings తీసుకుంటే better sir. 2 readings 1 week apart, and then only we can decide. And 2 different labs లో తీసుకుంటే better sir. Because ప్రస్తుతం ఎవ్రీ గల్లీలో ఒక ల్యాబ్ ఉంది. Each lane has n number of labs, and what are the standards, whether they are calibrating or not, that is also an issue. So to be on the safe side, at least 2 readings 1 week apart తీసుకొని తర్వాత మనం డయాగ్నోస్ చేస్తే బెటర్ ఉంటుంది.
Bharat, your take on this question, that patients come to you saying accidentally this is 2 milligrams above the range because last night I went to a party and I've repeated in other labs, sir, it's absolutely normal. So how do you tackle such patients, and what is the message?
During this brief period of a career of a diabetes specialist, I have seen that denial as the most plausible reason what a patient has. He always tries to deny. First he says that I don't have diabetes, the lab report is wrong. Once he has diabetes, then he says that I don't want to take medicine. So this is denial actually, nothing else. The only thing is counseling. Counseling can help us out to drive these patients to their right path, which is leading to lifestyle modification and treatment. We need to counsel them about the outcomes of the test. Secondly, as Dr. Yousuf has said, we need to check for the test whether it is right or not wrong, and that is how I do it, because I with this I have an opportunity to teach my patients about the NABL labs and what the standards of testing are. So if the testing is good, done at a good lab, which is a NABL lab or an accredited lab, it doesn't make sense to doubt the lab reports. It only makes sense then to teach and counsel the patient regarding the outcomes. And once we counsel, we spend 5 minutes with them, and we can then allay the anxiety of patient. We can then allay the fear of him, because most of the people are fearful just by hearing the name of diabetes. They see insulin hovering in front of their eyes. So once we counsel them, then they open up, and then they are ready to go for further testing in terms of HbA1c or 24 or 2-hour glucose testing, and all those things they are ready to do. So counseling, I think, becomes integral for these sort of patients.
Great. Dr. Nanditha, what's your take on this? If somebody says FBS is 2 milligrams away and next lab is 99 instead of 102. So how do you go about, and will you go by one reading or you'll take the help of HbA1c? How do you proceed with your patients?
So thank you, sir. So I think Dr. Bharat and Dr. Yousuf have sort of covered the practical points about counseling patients and how patients don't accept and are in denial. But I think recently, of course, there's been a lot of debate, and finally, HbA1c has also been accepted as one of the diagnostic criteria for both pre-diabetes and diabetes. And in such situations is where I think HbA1c will play a major role and sort of be something that will really help to sort of help with the diagnosis straightforward. So a normal HbA, of course, HbA1c, just for the benefit of viewers who do not know exactly what that is, it gives us a sort of, it's a 3-month average. It tells us exactly how the blood sugars have been behaving over the past 3 months. And the normal HbA1c would be less than 5.7%. So someone with pre-diabetes, the criteria would be between 5.7, anything above 5.7 to up to 6.5 or 6.4, you could say 6.5% would be a pre-diabetic stage. And once the patient crosses 6.5, then we say that it is converted to type 2 diabetes. Now, why does HbA1c sort of help further over here is because HbA1c, there's a number of advantages. Number one, the fact that HbA1c does not change if the patient has had a sweet the previous night or if whatever the patient has been doing the previous couple of days. It usually only changes every few months, which is every 3 months. And so it gives us a very clear idea how the blood sugar has been behaving over the past 3 months. Number two, it can be done any time of the day. It does not require the fasting state. These are the advantages with HbA1c. Now, of course, it does also, why the debate about this is because there are some disadvantages as well. Number one, like Dr. Bharat was alluding to, it needs to be done in a standardized lab because there can be a lot of lab to lab variations, and there are different methods, biochemical methods for assessing HbA1c. So unless it is done in a standardized way, you can get variations in HbA1c, number one. But that goes with any lab test, of course, particularly HbA1c, which is a very sensitive measurement. Number two, it is a very expensive, it's also not very, but it is a little more expensive than doing just a blood glucose testing. And so to convince the patient to go ahead and do a HbA1c, and may not be available in all labs and may not be available in more of the rural areas in some of the labs. So these are the disadvantages with the HbA1c. But
Agreed.
beyond those practical points that already Dr. Bharat and Dr. Yousuf addressed, I think the HbA1c is definitely something that does help with accuracy and diagnosis of pre-diabetes or diabetes
True.
itself.
So end of the day, you believe your doctor, you go to him, seek his advice, and take the proper treatment if prescribed. See, do not doubt about your previous night dinner, your partying, etc. And the doctor will advise, and probably will advise the lab also, which like NABL accreditation, because there has to be a standardization, and that's how we take it further. Now, why is it pre-diabetes we are talking about so much importance? Does it behave like diabetes when it comes to complications, or it is okay, it's a milder form of diabetes, we can relax because it's just the initial stage? Is that true? Bharat, your take?
Sir, it is important due to two reasons. One, it does derange the lipid parameters of the body and the other metabolic parameters, and in turn it impacts whole of the body first. And secondly, this is a stage, if we don't correct it, we'll end up into the full-blown diabetes, which is the disease we all know how dreadful it is, and then how the metabolic milieu disturbs. So these are the 2 points which prompt us to treat it at the level of diabetes only, because that way we can reduce the burden of complications. Once the diabetes sets in, the complication rates go up at a hovering pace with each % rise of HbA1c. So it is
So
better
the message, yes, the message is very clear. It's as bad as diabetes, because eventually we'll end up in diabetes and eventually we'll have complications also. So if you take care, this can be reversed. This is one of the conditions which can be very easily reversed through various maneuvers, which your doctor will advise accordingly based on your characteristics, based on your comorbidities. That means risk factors like obesity, smoking, family history, etc., sedentary lifestyle. So please do not neglect pre-diabetes as the initial stages. So let us, we'll look at it. That's our attitude, because usually the patients come to us with complications. The day somebody presents with diagnosis of diabetes, they'll have 1, 2, 3, 4 complications already set in, which they are not aware because of negligence. So please do not end up with that. Now, can we prevent diabetes? And if yes, what are the means? Nanditha, quickly, because we are running out of time already. quickly, how do you prevent?
Yes. So yes, it can be prevented, or in other words, at least delay the progression from pre-diabetes to diabetes. And yes, it is also a reversible condition, which you already addressed, sir. And there are many strategies which have been studied to assess which is the best. In our Indian scenario, we have found that we have the so-called IDPP, or the Indian Diabetes Prevention Programs, in which we have found that lifestyle modification, just simple walking and changes in your diet, and adapting to a healthy lifestyle can go a long way to further define that around in those who are overweight or who are obese, a mere 5 to 10% of weight loss can actually help with reversing the condition and preventing or delaying the progression to type 2 diabetes. However, having said that, this is, of course, to summarize and to consolidate the entire data. But in our Indian scenario, it is important to remember that many of us are not overweight, not obese. We have what is called metabolic obesity. So although we have a normal BMI, we have more of visceral fat, or what is called fat inside the organs. So just simple walking and dietary changes can go a long way in prevention. Now, there are also many drugs, like metformin is one of the best drugs which has been accepted to prevent type 2 diabetes even in pre-diabetic state. But that will be left to the discretion of your treating doctor.
Great. I think that was my next question to Dr. Yousuf. Can we treat pre-diabetes? So because patients think pre-diabetes is a condition before diabetes, so only lifestyle modification. That's what many of them believe. But are there any drugs where we can treat and reverse or hasten the reversal?
So personally, I would prefer not to give any medicines, but definitely as far as
recommendations, because somebody is very lazy. He says, I cannot oblige your diet and exercise because of my busy schedule. Like in Bangalore, we have this IT, where they say we work in a different time schedule itself. So we cannot afford to do this diet and exercise, what you're advising. Such patients, would you prefer drugs? And if so, what kind of drugs?
Sir, I think the gold standard metformin definitely works in pre-diabetes, helps also as it does in diabetics, because most of our patients are overweight or obese. So definitely it will improve the insulin sensitivity and decrease the hepatic glucose output. So metformin definitely we prefer. And we also have acarbose. Acarbose also can be used for a short period of time in pre-diabetic patients. It will not only offer glycemic control, but also some amount of weight loss, if not weight neutrality. So metformin and acarbose definitely I'll go for that in some set of patients, not all the
pre-diabetic. Exactly. See, because in practice, real world scenario, most of the patients do not oblige about the diet and exercise. They're not convinced. First of all, they're not convinced they're pre-diabetics. That's the biggest task, and 80% of our time goes in convincing them or educating them that they have pre-diabetes. Because
for our patients, we have to use medications lifelong. That is what
exactly. So that education part is the key. Please consult your doctors. Please do not neglect the lab reports, which you can afford to get annually once a year. About 1,000 rupees, all of you should spend to get your metabolic profile, which includes sugar, cholesterol, and a kidney test. And if required, a ECG. That depends on your doctor. Please consult them at least once a year above the age of 35 years, irrespective of your family history. This is another myth people have. My parents lived 100 years, so I will not get anything. But this guy has got a body weight of 100 kilos, so he will bound to get diabetes in the present scenario in Indian context. So that's something. Education is the key, where you need to enlighten. And people who are listening to this, please look at your family members, the body weight, the hip waist ratio, which is a simple tool which you can measure at home, and consult your nearest doctors, your family doctors, so that these can be prevented, detected early, so that the burden of diabetes in future can be prevented. I think we are on time, and Dr. Faraz is already indicating us from the backstage that we should not overshoot the time, because he's not going to pay us anything apart from 8 o'clock, after 8 o'clock. Faraz, over to you. Of course, it's our endeavor at RSSDI to educate our public, our patients, the relatives, so that they do not end up in complications. Most of us will end up in diabetes, being Indians eventually over age, but we do not want our patients to end up in complications. That is our main motto, and education is the key for this, where we are trying to educate patients in a weekly manner, and that's the best part of RSSDA. We are celebrating 50 years. Recently, we had our 50 years conference, national conference in Chennai, and Faraz is back. Faraz, over to you.
Yeah, Uh, I would say thank you, Srinivas. And then, I'm sure what we all are paying you is words of appreciation, which you will always get from all of us. That is all we have to give it to you and the entire team. I would say at the end, thank you all of you for discussing the important practical aspects. I think that was the need of the hour because we can speak length and volumes about the subject, but I love the way you took out the practical points, which are very all of us face day in and day out. So thank you to each and all of you. Thank you, Dr. Bharat. Thank you, Dr. Yousuf. Thank you, Nanditha. And then, of course, a big thank you to Dr. Sreenivas for moderating the excellent show. I would just say that, yes, as all of my colleagues have said, that take your lifestyle seriously. This is where it is very important from you to get, or I would say prevent, from that pre-diabetes to diabetes. Because once you are diagnosed with diabetes, then there is no go or no going back. So it is always better to have a healthy lifestyle, be physically active, and then at least I would say hit, if not 10,000 steps per day, at least 5 to 8,000 steps per day. So thank you all for joining, and see you next week in another episode of Diabetes Bytes. Thank you.
Thank you,
Good night,
Bharat,
everyone.
and keep
Good
the
night.
good work going.
Thank you, everyone.
Thank you, everyone. Thank you, everyone. Stay
Thank
safe.
Good night, sir.
Bye.
Thank you.
Good night.
Thank you. Good night. Good night.